Welcome to the tour of the CHI Health St. Elizabeth's Maternity Center. We are located at 555 South 70th Street in Lincoln, Nebraska. Free parking is available in our parking garage attached to the hospital. As you enter the hospital from the parking garage, take the West Tower elevators to the 4th floor. When you step off the elevator, you will be greeted by our patient registrars who will register you and complete necessary paperwork. But if you need to be seen urgently, you will be taken directly to your room. Our unit has 12 labor and delivery rooms, 2 OB emergency rooms, and 2 operating rooms. Our labor and delivery rooms are large private rooms with large bathrooms and jacuzzi tubs, wireless internet, a couch and recliner, and all the equipment needed for mom and baby. If you are in need of care prior to arriving for delivery, our OB emergency department is located within our labor and delivery unit. Our OB hospitalists are available at all times, day or night, to assist with any emergency. St. Elizabeth has multiple options for pain relief. Some patients desire an unmedicated birth, while others choose to use IV pain medication, nitrous oxide, or an epidural. Anesthesia providers are available at all times of the day and night. You may change your mind throughout your labor, so communication with your nurse is key. If you are scheduled for a C-section, you will arrive to the maternity center about 2 hours prior to the scheduled C-section time. Our operating rooms are on the same floor as labor and delivery, so most times you will be able to recover for the first 2 hours in a spacious labor and delivery room before being transferred to our mother-baby department. Your support person can be with you the entire time, from registration, in the operating room, and the recovery room. After your delivery, your recovery period is about 2 hours. During this time, we encourage mom and baby to remain skin to skin for the first hour and breastfeed if you choose. During the last half of the recovery time, the nurse will weigh and measure the baby, assess the baby, and give any medications that have been ordered. After the recovery period is over, you will be transferred to the mother-baby department just on the other side of the 4th floor. Your baby will have their first bath about 12 hours after birth, or whenever you desire. The bath can be done in your room, and you can participate if you wish. Our mother-baby department has large private rooms, many with queen-sized beds. We encourage your baby to room in with you during your stay, so your baby's crib will be stocked with all the supplies you will need: diapers, wipes, blankets, and a t-shirt. You will need to bring clothes for your baby to go home in, and a blanket and car seat cover, depending on the weather. You'll also need to bring a car seat so that it's not expired or been in an accident. It is important that you know how to install and use the baby's car seat, as staff are not permitted to install or place babies in the car seat for dismissal. All the supplies that you will need during your hospital stay will be provided, such as pads, disposable underpants, and ice packs, but you will want to bring toiletries such as toothpaste, toothbrush, and deodorant. You can wear a gown while you are here, but may be more comfortable in your own comfortable clothing and supportive bra. During your stay, you and your support person can enjoy our room service meals for breakfast, lunch, and dinner. You are able to order from our food service menu for each meal, and it will be delivered to your room. If you have chosen to breastfeed your baby, please know that we have certified lactation nurses here to help you. We want to support you, so don't hesitate to ask for help. If you choose to formula feed your baby, we have formula and bottles available here for you. CHI Health St. Elizabeth has an award-winning neonatal intensive care unit that is staffed with expert nurses, neonatal nurse practitioners, and neonatologists. We are always available to help in the event your baby is born prematurely or in need of extra care. Our 27 private rooms are also on the 4th floor, just down the hall from labor and delivery. Most moms go home 2 days after a vaginal delivery and 3 to 4 days after a C-section. Your discharge plan will depend on how you and your baby are doing. Be sure you have chosen a provider for your baby before coming for delivery. If you need suggestions about who you should choose for your baby, ask friends and family, your OB provider, or look online. St. Elizabeth has pediatric hospitalists who are available to see your baby while you are in the hospital if you do not have one chosen prior to delivery. We are committed to safety at CHI Health St. Elizabeth. Shortly after delivery, your baby will have 2 identification bands placed on their wrist and ankle, which will match your bracelet and that of your support person. Your baby will also wear a security tag on their ankle as another layer of security. Also, staff who work on the 4th floor will always have a pink border on their name tag. Visitation is restricted to 1 entrance point on the 4th floor. Adult visitors will be given a name badge to wear during their visit that will be returned upon leaving. Visitation rules may change due to community guidelines. We know you have a choice where to deliver your baby. We thank you for taking the time to visit our maternity center and look forward to seeing you when it is time to deliver your baby.